illness comes in from the mouth. So they can look inside, look at your tongue and say, oh, you're anemic, or they look at your gums and they say, oh, you're depressed.
You're specialized in perio, as you said. You do a lot of complex implant work, bone regeneration. Where did this passion come from?
When I came out of dental school, I really wanted to be an orthodontist. All my exams are ready. I did all my internships. Like half my foot was in the residency course. Then I would call this like a butterfly effect. But what happened was that I went for this talk.
Welcome to ProTalk. Welcome to the Pulse of Dentistry. And today, welcome to Villa Moura in Portugal, where we record this episode from the International Aesthetic Days, which for us at Straumann is one of the most important events in a year, speaking about excellence in aesthetic dentistry. Today, we have a very special guest that is not only special because of her special clinical skills and clinical excellence, but also very special in the way she's engaging with patients, and you will learn throughout the episode about this. So welcome, very warm welcome, Dr. Marlene Teo from Singapore. Welcome, Marlene, great to have you.
Thank you, Andreas, for inviting me.
And thanks
thank you, Straumann.
And thanks for coming over to Portugal. This was a long trip for you.
I know.
And it's a pleasure to have you in the ProTalk, but also later to have you on stage here at the Aesthetic Days. So really looking forward to this. So in this episode, what will be very special is we will speak a lot about patient engagement, patient communication, building connection to patients. So if you think that this is just any soft skill or doesn't matter at all, I think this podcast, this episode will make you rethink, and you will just realize it's a superpower that you want to build for your practice. And I think, Marlene, you're just a great person to learn from this topic. So Marlene, to introduce yourself, who's Dr. Marlene Teo in 1 minute?
Okay, I am a periodontist from Singapore, and I think by accident, I found out that I'm really engaged in holistic wellness. Okay, so I think in society, there's a little bit of misconception how like holistic wellness is a little bit like woo, crystals, blah, 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 blah. But to me, holistic wellness is about integrating holistically through health, spirit, body, and mind to enhance the immune system so that you can have absolute health. And this includes the mouth. So I would say that me as a periodontist, I would say that what defines me currently is how I would like to integrate holistic wellness into my practice at Dental in Singapore, and also Dental in Singapore as a periodontist. So this is me in a nutshell.
Cool. So welcome, Marlene, and happy to dive into this topic more. To start with, today you are a dentist. How was your journey actually to enter this field from the very beginning?
So I come from like a family of doctors, and I did it for two reasons. Okay, one was a pure act of rebellion. So my parents, it's like Asian parenting. They just assumed I was going to be a medical doctor. But, I was at that stage in life where like if you told me to do something, so if my parents said you can't dive, I would be like taking a diver's course and like diving the next day in secret, right? So I did dentistry partly as an act of rebellion. Plus, I also saw that all like the smart kids were actually going into the medical field, and I saw a blue ocean in dentistry. I was like, wow, for once, I don't want to be in the rat race. This is something, so I wasn't passionate about dentistry itself. I was just like, wow, but dentistry is exactly like medicine. Why is everyone going this route? So I was like, since no one's going there, I'm gonna go ace it. So I did. So that was my reason why I chose dentistry in the first place. Part rebellion, part blue ocean.
Okay, I never regretted it.
Oh no, it was like the best act of rebellion ever.
And dentistry is a broad field, and you focus on some of the most complex treatments that you can focus on. You're specialized in perio, as you said. You do a lot of complex implant work, bone regeneration. Where did this passion come from? Because you could have also taken another route within dentistry.
So it's interesting because I think there was a misunderstanding somehow that I was an orthodontist. And the very interesting thing is, when I came out of dental school, I really wanted to be an orthodontist. So I had done all my applications. So I took my exams. So all my exams are ready. I did all my internships. Like half my foot was in the residency course. Yeah. Then I would call this like a butterfly effect. But what happened was that I went for this talk. And at that point in time, Ray Williams was in Singapore, and the lecture was actually on periodontitis and systemic health. Okay, so initially, just to backtrack a little bit, the school, National University of Singapore, had wanted me to go overseas to do periodontology, and I said, no, there's no way. It's so dirty. I'm not going to be a periodontist. So that was an option. But when I saw Ray giving his talk on systemic health, I turned to the guy who happened to be beside me. He's one of the most powerful figures in dentistry in Singapore. His name is Prof. Patrick Singh. So I turned to him and I said, maybe I should be a periodontist after all, like half sarcastic, half joke. So at lunch, he goes to the dean of the dental school, Prof. Kee Sen Tan. Kee Sen Tan goes to Ray, whom he knows, and he said, take this girl. So I got into North Carolina, the University of North Carolina in Chapel Hill, the periodontology program, which was probably one of the best programs in the US at that point in time because I made a joke. And when I interviewed with Ray, I even told him, I'm not sure that I like blood. And imagine there's so many other people competing for this spot. But he took me. And to this day, I don't know why he took me. And I remember his words to me when I said, Ray, actually I call it Prof. Williams. I don't think I like blood. I'm not sure what I'm going to do when I get into your program. And he goes, Marlene, you just might change your mind. Okay. And to this day, I can't sit through a lecture without seeing any blood. So I became a periodontist by what I call a butterfly effect. It's almost like destiny. It switched overnight because I made that comment too. Maybe I should be a periodontist, and it came one full circle. So this passion comes maybe from destiny, and also the fact that I realized I really do like to see blood. I love rehabilitating dentitions, ripping out all the old teeth that are really failing, and putting them into a body that is able to accept these new implants. Because without health, if your teeth are already falling out, if you put in the implants, your implants are going to fall out as well. So to me, the passion comes from a few of these things. Yeah.
So this guy in North Carolina has probably seen something in you that you didn't. And maybe at one point you want to ask him what it was, but he saw your talent probably for it.
And also, so I did ask him, I was like, why did you take me? And you know what he said? He said, I wanted to see people all over the world that was trained in periodontal medicine in the University of North Carolina. So that was his aim. And I just happened to be in the right place at the right time. And I hope I will be able to grow this legacy in Singapore and maybe Asia.
So this is how you decided to become a periodontist, or
yes.
Let's say surgical specialist.
Yes.
Was there a specific defining moment where you then realized that you said, look, we can do all of this in a more human and more connected way to the patient?
Yes. So I would say that I wanted to connect more closely even when I was in the dental school. So it wasn't when I was a periodontist. There were actually two defining moments. The first moment was when I was in dental school and the patient said, I hate you. You look so young. And as dentists, we get this all the time. I hate you. Excuse me. It's nothing personal, but I hate dentistry. And I was thinking at that point in time, because I come from a family of doctors, I don't see my dad, who's a gynecologist. Nobody says that to him. You don't say that to your cardiologist. Why do people say that to dentists? So I realized perhaps
It's true,
it's true, right? So it was the way we were communicating with patients. Why do patients hate dentists. So that's number one. So that was one defining moment. And when I graduated from dental school, because I was the valedictorian, they interviewed me and they said, what do you want to change in dentistry? And I still have this record like in the papers. So I said, I want to change people's perception of dentistry in the year 2000. Okay, but I forgot about it. I need to let you know that I forgot about it. I continued with my career as a periodontist. Then as a periodontist, what got me to switch again was I felt that I was doing all my surgical stuff well. I was putting in implants nicely in the correct position. But strangely enough, when I became a yoga teacher and I started to find myself more, in yoga, I think you have to sit in wellness, like you sit in stillness actually. And then when you come like more into yourself, you start realizing, oh, is this what I really want? So when I sat with myself, I realized, hey, what's lacking in myself is this ability to connect with the patient so that they have like a better experience with dentistry. And then I remember what I said in the year 2000, and I said, oh, I lost myself along the way. And now it's time to come back to it. So there were two defining moments, actually. Once when I graduated from dental school because of what patients said, and two, when I sat still and came in touch with myself. So there were actually two defining moments.
Yeah. Yeah, these moments are very powerful. We don't have them often enough, actually. That's why yoga is such a powerful exercise to do.
Yes.
So let's start diving into this, how you do this, Marlene. I'm curious, and I would like to start actually with your practice. You said your practice, that the practice that you built is An Dental. What is the meaning behind this word An, and why did you choose it in the first place?
So I wanted a practice that could bring peace and safety to the patient, right? So I wanted to work on that fear and why people hate us. So the word An in Mandarin is actually, it means peace, right? So peace means, so in Mandarin we say 安全安稳. 安全 means safety, 安稳 means stability. So I wanted to give a place which provided peace, safety, and stability to the patient. Now, the very interesting thing about An is that the word An in Mandarin, the word is actually modular. So the word An, the top part is called a 宝盖头. That means roof. The bottom part means 女, means woman. So when you combine the top part with the bottom part, it actually means you can have peace and safety with a woman's touch because it feels like home. So the whole word represented my Asian roots and what I wanted to give to the world. So the word An itself was because of that. And my logo designer came up with a really interesting concept where he put a circle around the word An because you don't just want to be empathetic to the patient and give them a sense of security. You also want to give them precision, surgical accuracy. So he put a circle around the word An to create a seal of trust. So that's where the An name came out and also how the logo came out. So that's where the whole An came to express what the vision that we wanted to bring to the world.
So, I mean, it's a very thoughtful way of designing your name, and I think it's pretty much reflects also your philosophy. And I read in an interview that you said, look, let's say dental phobic patient, if we can say, and there are lots of those, and I think everybody knows, and I wonder why this is, but they need to feel welcome and safe to let go. So how do you navigate through this with the patients that are coming through you, that they let go, this fear, this anxiety, this shame that they have in a situation in a dental practice? How do patients experience this?
So I think very importantly, we have to go through the 5 senses. So what creates safety in someone, I would say, comes to sight, smell, touch, taste, hearing. Yeah? Sight, touch, smell, taste.
And hearing, yes.
And hearing, okay. So I think we created a very safe environment. So like we use muted colors that are calming and flowing. That's one. And then also like sound, we play music. And then we have a team. And then we touch on all the senses. Like, so even when it comes to feel, we give weighted blankets. And also like little squishies to hold whenever they're feeling nervous. But I think what's very important also, we hire a team that's very empathetic. So it starts right from the front desk to the nurses and to the doctors. So once we're able to bring them into the environment, there's some people that freeze because of fear. And when that happens, as a doctor, I think the first thing you need to do is not to try to approach. You know, when someone's fearful, if you try to like go in, the first thing they do is to climb up. A person who's stuck in fear, shame, or anxiety always has walls. And I liken it to a dam. So you can't go in and say, like, you can't bash that dam because there's so much pressure inside. That pressure is stronger than whatever you could poke, yeah? But you have to be safe enough for them to open that door up a little bit so that they can let the pressure flow out. Now, once that pressure flows out and it goes away from their brain, they're able to think properly and express what they want to feel. And so how do you let them open the door? I feel that you know, emotional dentistry is something that's really, really important. You don't just say, hey, I'm going to sort this out for you. The first thing you do is to retreat and say, why are you here? That's the number one question. Number two, why do you fear the dentist? So usually when you say, why are you scared? The patient pauses because they actually don't know why they're scared. So when then they will tell you a story. Oh, you know, when I was a kid, I was traumatized, blah, blah, blah. Oh, I really hate the sound of the drill. So number one, you have a factual thing. And I'll say, oh, you know, the instruments here are very quiet. But the first thing is to get them to open up. And then you start hearing their problems. And then the next step is not to jump in to solve the problem. I think the most important thing is to remain in yourself so that they can come to you and express what they're feeling. And once that dam opens, right, you're able to sort it out. Because the funny thing about trust is that when you don't, trust has to be earned, and you don't earn it by doing things or anchoring in that person. If they're able to come to you and they feel safe in that space, once you develop that trust, things just flow, and then they're going to be able to listen and hear, and all that shame and anxiety actually gets let out like a dam, and then you're able to come up with a treatment plan and say, hey, I can sort this out for you. But that could take the next session. So the first session is almost like therapy. You open it up a little bit and it comes out, and then you can, and then you go in with the treatment.
Is there like a specific methodology you use, or like psychological technique as well? Because I imagine, I mean, the way you phrased it, and you have a very mindful way of asking question and then behaving, not jumping in, solving the problem, but still opening the patient. Is that something that you learn from somewhere, or that is a specific technique, or you developed all of this by yourself based on your instinct?
I don't think I have a specific technique, but I think yoga and stillness and maybe divinity has kept me more centered nowadays. So rather than an experience as well. So like if you keep pushing someone and you realize there's no entry, sometimes the other way is just to retreat and be an observer and see what happens. So it's a technique that I wouldn't say I've developed, but just by watching people and even watching people whom I admire, you see how they approach people. And even in life, it's not about dentistry. Why do some people encourage people to open up to them? Then I realized, oh, this is the technique. You just don't go barge in. You let them come to you. And you do that by opening that door just a little bit. So I wouldn't say there's like a specific technique, but it comes with a lot of, number one, groundedness, and two, empathy, and being able to listen and understand, and three, refraining from trying to solve the problem immediately.
So you literally developed it by yourself?
Yeah.
Based on your background and learnings.
Yes.
And I know you have a lot of let's say, surrounding education as well on be it nutrition, holistic medicine, and much more. But you know, can people learn from you? I mean, do you share your knowledge? Like, do you give courses, or is there no time for doing that?
no one's asked me, so I don't know. Like, it's the first time I'm articulating what I do. This is literally the first time. No one's actually asked me. So, like, when this podcast was really interesting because when you ask me these questions, it forces me to like sit down and say, what am I actually doing? So, yeah, I've never given a course. I've never actually thought about it, but I would say this is an actual technique to get people to open up first. Yeah.
You're very, very mindful about the, I would say, mouth-body connection or periosystemic link as well. So beyond what you do with the patients and how you make them feel in your practice based on the 5 senses, what else are you looking into the treatments to optimize the treatments beyond just I would say the clinical dentistry treatment? Is there something on nutrition that you're doing on other holistic medicine approaches?
So once we break that fear barrier, right? So the next thing, our motto at Undental is as within, so without. Okay. So what it means that without inner health, you cannot have a sustainable outer appearance. And the outer appearance means the mouth as well. So what we do is we really, really emphasize on like the medical issues. So when you come in, of course, everybody takes like a medical history. But once you're diagnosed with gum disease, we don't stop there. We want to know why, right? So all our patients have to go through additional medical testing if they have not done so already. And this medical testing includes pre-diabetes. We're not talking about diabetes here. We're talking about doing a glucose tolerance test, right? We're also doing a HbA1c test to see how much sugar there is. So sometimes you can pass your fasting glucose, but it doesn't mean that there's like sugar. You need to find out if sugar is like stuck in your collagen as well. We also do a lot of vitamin D testing. So vitamin D is shockingly underdiagnosed in Asia because, especially in Singapore, you think it's so hot. Everybody.
It's so sunny, yes.
It's so sunny.
Yes.
But what a lot, and me included, I was diagnosed with low vitamin D because I don't want to go to the sun. I don't want to get freckles, right? So I'm like indoors all the time. I'm wearing sunblock. And my vitamin D levels were like 18 or something. So I realized that if I was vitamin D deficient, so many other people are as well. And when we do the vitamin D testing in our clinic, we find a shocking number, maybe like 90% of gum disease patients in our clinic are actually vitamin D deficient. So because of all those tests that we run, we support that body-mouth connection from the inside out as well. So I would say that really helps maintain the stability of the gums because you can clean and clean and clean. But if you're not sorting out your body, your tooth is still going to fall out. Your gum disease is going to recur, relapse if there's something untreated like high sugar levels, thyroid illnesses, or even hormone imbalances like polycystic ovarian syndrome. So all these things contribute. So I would say that in our clinic, we really emphasize what's happening in the body as well. Yeah. And
so you really go down to the root cause. Huh?
We do. And I think what's very important is management of stress, which is where my other sideline interests actually come in. So it seems like sometimes in my life, I have all these like varied interests. But in the end, the very weird thing is that it's all supportive of what I'm doing. Like I became a yoga teacher in 2016. I was just bored. I was like, started on yoga. I just found it intriguing. And then when I realized that I became a lot less stressed because of yoga, I said, hey, this is a wonderful way to reduce stress. So during that period, there was not much educational literature on yoga and gum disease. But nowadays, there are few reports coming out how yoga can specifically relate to gum disease, but very specifically, yoga has now been shown to reduce stress in so many ways. And by doing that, reducing stress as a risk factor for gum disease, you enhance the stability of treated gum disease as well. So, that's how we help patients.
That's very interesting, Marlene, is also you prepare the patient holistically based on the 5 senses. Then, you look at them holistically from a systemic perspective and you prepare them, you eliminate deficiencies like vitamin D deficiencies. So you prepare them. So if there's the day of surgery now, because at one point there is the day of surgery, how do you specifically prepare this day and the patients for that day so that they feel comfortable in these treatments? That can be scary for patients, I understand. And you do some complex cases as well. So how do you support the patients at the day of surgery?
Okay, so on the day that they come for the consultation, you usually get a feel about whether this patient needs sedation or not. So there are some patients that cannot sit on the dental chair. And those patients, sometimes we even let them. So we have these patients that burst into tears in the waiting area. So they won't even go. The phobia is so great that they can't even walk into a dental room without crying. So I have this flashlight. So sometimes I do my treatment planning in the waiting room, just by looking at them. And I say, I'm not going to hurt you. And then I have this flashlight and I look in and then I say, hey, I'm just going to touch you. And then I feel all the shaky teeth. And then we send them for x-rays, CT scans, and we do the workup with photos, right? So basically, I'm not touching them. All I do is use my fingers. I have no tools. So because they're in the waiting room, they feel safer. So these kind of patients, there's no talk, they're either going to be sedated or GA. Then we do the big surgeries on them because all these all-on-4 cases, sometimes all you need to do is to clear that one big hurdle. And once you do that, they feel so proud of themselves, they're able to come back for the reviews. So I would say there's this first subset of patients where they just cannot sit in the dental chair. Then there's another subset where they're scared, but you can work on them, right? So those kind of patients, you can go through the steps without sedation. You can do that with local anesthesia and all that. So with local anesthesia patients, what we do, again, we engage the 5 senses. They come in, we have aromatherapy. So I was like, what smell do you want? So we have a range of scents in our office. Okay, we can burn, we have lavender, we have a mixture. We play their favorite music. So every room has a stereo system. You can watch TV. So we treat them like kids. We have nitrous as well, which I seldom use because I don't like it blocking my way. So again, then we have the weighted blankets, and then we have squishy balls. So when we're using the squishy balls, sometimes we ask the patients, can we tap your shoulder? And they were like, what? Then we're like, yeah, just tap your shoulder. And then say, open your mouth. And then we're giving the injection after putting topical anesthesia. We get them to think. So I'll get them to think of the left shoulder. And when they're thinking of the left shoulder, I say, breathe in, and then the needle goes in. So they were like, oh, I didn't feel that. So it's a lot about distraction if you're treating a patient with local anesthesia. So now if I can do that with local anesthesia, once they're numb, we can do everything. And we can do it fast as well, because I think our team is trained to manage fearful patients and to go in and out as fast as possible. The other tip that I would say is really helpful to practitioners is that don't lean the patient 100%, to 180 degrees. What people fear in dental chair is the loss of control. So if you put them at 45 degrees and they feel they can breathe, you can do so much more. So I would say these are the few tips that I could give if the patients are not knocked out. Otherwise, knock them out or all these tips to keep them safe in the chair.
No, thanks. It's very tangible. I would like to go back to one point that you mentioned earlier. Now making patients feel safe, it's not only about you and your practice, it's also about your team, right? It's a whole culture that you need to build in your practice. So how do you select the people that work for you? And what would you say if you interview people, what skills? First of all, do you hire for skill or potential? And the second one is, what behaviors is non-negotiable for you, or what characteristics are non-negotiable?
So I would say I'll talk about the nursing staff first, okay? So to get nursing staff, you have to start with the A players, and you have to be very clear about what you want. So for example, for me, I hire based on integrity, number 1. Intelligence and initiative, okay? This is from Warren Buffett. This 3 I's is actually attributed to Warren Buffett, but I think a lot of people have talked about it. And he says that without number one, which is integrity, the other two become dangerous qualities. And I totally agree with that. And when we hire for intelligence, I'm not talking about IQ. We're hiring for emotional intelligence as well. The person that can read the room. So the first few people that you hire must embody this in an A standard. Because the minute you start with a B, this B is going to set the tone for the rest of the company, which means that I have to be an A as well, right? So if I'm hiring, I better make sure that all the other players are of a certain level. So the first step is to hire that A player that exhibits these three qualities. Then from then on, everybody has to match the standard. And one of the things that I say, and this sounds almost cruel, is to fire fast. And I think it's a great strategy because if they come in and they don't fit, you have to have that difficult conversation. Hey, I don't think you're like a great fit for the team. You might be better off elsewhere. And it's like dating. You don't waste anybody's time. So you switch it up. And there's and the one that sticks, they really stick. So for a long time. The minute they join and it fits, they're in there forever because now they've joined the locker room. It's like a soccer team, you know. If they get along in the locker room, they're also going to be like a really tight team. So right now, even when I'm here, they're hiring people. The team is hiring people, the nurses. So they meet the team first, and I say, does this person fit? So they'll say, oh, I think her vibe matches. Then they'll say, okay, they call me Laoban, by the way, which means like boss. So like, should we hire her? I was like, go ahead, sign her on. But I will have that conversation with this person and say, hey, right at the start, so nobody gets hurt. We're hiring based on whether you fit the team. I don't say, oh, are you an A player or not? We'll hire, and if it's not a good match, we may ask you to leave, or if you feel that you don't match, you need to let us know and we let you go. So it's like a 3-month testing period, and usually after the first 2 weeks, we can tell. So the ones that stick forever, and the ones that don't just leave. So that's how we hire our nurses.
I can tell you, Marlene, it's very similar with us. So I can only agree. You shouldn't compromise, and often people you let go, that they find a better home elsewhere as well. We have to clearly see this. It's not only about us; it's also about them. So
agree. They find a better home elsewhere, and they're so happy somewhere else.
Exactly. That's true. It's a lot about emotional connection, what you're speaking about. So is a too deep emotional connection at times an issue for your people? Like, is it important that sometimes you teach them also to have a distance between the patients and themselves? Because you try to emotionally connect deep, but sometimes you don't want the people to take this home, probably. Your staff, is that becoming an issue, or did this become an issue for you at one point?
So I think the thing about emotional connection on a dentist level is to not let it affect you. Because if you feel too involved in that story, you get thrown off center and you're of no use to anyone. So I think everyone in our office detaches the minute we go home. The other thing that we do is that we try not to engage with people that don't match our vibe. And this includes patients as well. So we select our patients as well. Not in a... So what I mean about selecting patients is that sometimes if they come in and they're rude to the staff, sometimes we let them go right at the counter. Or when we do the consultation and this person just, this is not a good fit, we actually say, hey, we might not be able to help you in this area, and we send them off with their x-rays. So by not engaging with someone who's going to drain your energy, I think it protects us as well. So like our family of dentists and nurses, we remain intact. So we have that high energy and empathy to go on to the next person that like matches our vibe and wants this kind of treatment from us, I guess. So
let's move a bit on to another topic that was very insightful, by the way, Marlene. You're also into mentoring. I mean, you are leading also the Women in Implantology Network in Southeast Asia, which we are very grateful for. Where is this, let's say, this passion for sharing and helping other young female talents flourishing? Where is this passion coming from, and why do you do it?
Okay, so first I need to qualify something. I've actually stepped down from the leadership in WIN. I'm still part of the core team, but I'm not.
But it's still a core player, isn't it?
I hope so. But the passion, I would say it's a passion, and sometimes I'm almost embarrassed to talk about it. I'm not sure if people want to hear from me, but what I would like, I just like to share my experience, and hopefully they can learn from my mistakes as well. So I think what a lot of females ask me is, should I have kids? Okay, so that's another thing that I get asked a lot on a casual basis. Should I have kids? Like, how does it affect your career? And my answer to them was, if you want to have kids, but know that it may affect your career, and it very, very likely will. Even if you have a supportive partner, or if you have supportive family, just taking on an additional basket is going to mean that you're going to have to take some time out from whatever you've carved out, right? So expect to have a dip. So you must know that you're going to have a dip. It is not possible to do it without a dip. But you must also understand that like kids grow up and leave the nest. So if you're able to accept the fact that you're not going to be able to give 100%, for example, to writing 100 research papers, and you're okay with writing 70 research papers per year, and you're okay with that, by all means have a kid, because this is going to take up your energy again. But then, once the kid grows up, you can go up to writing 200 research papers, because now they're big. So if you want to have kids, please do so. And it's, how much that dips depends on how much support you're getting from the outside. And you can have it at any point in your life. Just for me, for example, I gave up lecturing in 2012. I thought I was done for good. I was only working 3 to 4 days a week when my kids were small. And I thought I would never, ever be on the lecture circuit again. But again, through a twist of fate, and I'm not sure why I'm back doing it. So I don't even have pictures, because I just stopped lecturing. So I stopped taking pictures. I take pictures to assess my own surgical skills. But now suddenly I'm back on the podium speaking about emotional dentistry in the world circuit. So it's like a really strange twist of fate. And I'm back. So
that's good.
Yeah.
But I think that's the beauty of it, Marlene, that, this is exactly what, the young next generation of, female clinical leaders can learn, from careers like yours. And I think that's very encouraging, to see this, If you look into the future of dentistry, what it would be your wish, where dentistry and especially implant dentistry is developing based on, let's say, your ecosystem that you built?
So I think number one, I would like dentistry to be unified in itself, right? So right now, you can say we're working in multidisciplinary teams, but how much do you know about orthodontics? How much do we know about sleep apnea? How much do we know about even like the prosthetic part? If you're putting an all-on-X treatment, you can't say, oh, I'm just going to slam in the implants and someone's going to put in the restorative. But what if the patient crashed out his teeth because he had sleep apnea in the first place? So I would say in dentistry, we need to learn all that right down to the base. And I think Ancora Imparo is doing a fantastic job with this term, unified dentistry. They're going to hold a 3 master, like they call it the 3 masters. And the theme, it's unified dentistry. So we already see this in Asia. People are trying to, Dr. Jeanette Chua, who's been a guest here, she's really a huge proponent. I'm like a fangirl of hers. She's so like she's put it all together in dentistry. And I think the quality of education that she started for dentists is just phenomenal. It's exceptional. So that's Jeanette and unified dentistry. And what I would love on my part is for dentistry to be considered a body part, right? So in medicine, you have like the gynecologist, you have the cardiologist, but where are the dentists? So my dream is for the medical specialty to understand that. Okay, so in Mandarin we have this phrase, 病从口入. That means illness comes in from the mouth, right? And I'm sure they meant like, food, right?
Mm-hmm.
But the Chinese traditional TCM, they actually look into the mouth to diagnose your problems, right? So they can look inside, look at your tongue and say, oh, you're anemic, or they look at your gums and they say, oh, you're depressed. So a lot of these things are actually connected to the mouth. And so I hope one day the medical people will say, hey, why is there high CRP? How come there's so much inflammation? And you don't go looking for all the other body parts. Maybe start looking in the mouth as well. So if there's this integration of medicine and dentistry, it would be absolutely beneficial to
that would be
everyone.
very powerful.
Yeah.
That's a very beautiful dream to have, Marlene.
That is my dream. Yeah.
Thanks for sharing all these insights, Marlene. That was very interesting. Also wanted to give you the opportunity to ask a question to me or to Straumann that you always wanted to ask.
Okay, so for Straumann, where you're known for like surgical accuracy skills, basically hard skills, are you guys doing anything in like the holistic wellness space? Is there room for improvement in your company?
Oh, that's the question that suits very well our conversation. For us, a very challenging one. And yes, I mean, we are known for, everything starts with titanium parts. As you said, it's hardware that we do, but we have some instances where we start to look a bit more holistic. Like we have, we have a company called Botis that we are partnering with. And I think that's one very little example. It's about vitamin D, where we start to distribute also vitamin D. This is not only the vitamin D, but the testing before. So clinicians can test the vitamin D levels before they do surgery. It's quite similar what you do. I mean, you do it much more holistic. But here you can test the vitamin D level, and in case there is a deficiency, there is also then a vitamin D dosage that you can give, and you can build this back up again before you do the surgery. Because this is what we find, that there is more and more evidence coming and showing that it does do a difference in terms of, let's say, bone healing, but also tissue healing. There's more and more evidence coming today. Many people would say the evidence is maybe not yet strong enough, but we see also that actually that it's a trend that a lot of clinicians are starting supplementing the patients, which I think is an excellent trend to do. So we start slowly but surely, but I have to say we can learn a lot from you, Marlene.
Thank you, Straumann. This is great. Like that test kit right before the surgery is going to be so helpful for everyone.
Exactly. It's a blood test that you can do. I did it myself as well. Started supplementing after as well.
You are vitamin D deficient?
Yes, not anymore probably.
Okay.
But yes. So that's I think a little piece that we can do. So thanks a lot, Marlene. That was a very interesting conversation. Thanks for sharing and, taking us into this very different world, yet very important world, because we know, it's the patients. It's not a functional visit that they want to do, that they want to feel well. And that there are a lot of people that have anxiety going to dentists. We know it. And I think the way you approach it, there are a lot of learnings for clinicians out there that they can take from this. So the first learning for me, I think, is to have a holistic, balanced approach. It needs a holistic and balanced person leading it, which is you in this case. I mean, you are really balanced in yourself, right? And you do a lot for this yourself. And I think if you would not be balanced and is mindful, it would be very difficult for you or impossible to implement this in your practice. And then I'm very impressed how you built this, systematic with, looking on the 5 senses, how you select your team. I think, again, we come back to the team and how important the team is to make this a success, because you are just a very small experience
I agree.
in the journey of a patient. So I think this was very insightful. So thanks a lot, Marlene.
Thank you for inviting me. I very appreciate it.
Our pleasure, and looking forward to your lecture now here at the Aesthetic Days. And to all the listeners, thanks for listening in. I hope you felt also this was a very special episode, and please watch out for new episodes to come for Straumann ProTalk. You can always interact with us. We are very interested in your comments, your thoughts, your ideas, your questions as well. And best be done on our Instagram account, which is Straumann Global. We are always happy to receive your direct messages. So thanks a lot for listening in. See you next time. Thanks a lot, Marlene.
Thank you so much, Andreas.